Alzheimer's plaques. The year is 1906. A German psychiatrist named Alois Alzheimer presents a strange case. A deceased patient's brain is riddled with unusual clumps and tangled fibers. He has just identified the physical hallmarks of the disease that will bear his name. Today, Alzheimer's is not a medical curiosity. It's a slow-motion epidemic. As of 2024, it affects an estimated 6.9 million Americans, a number projected to nearly double by 2050. The disease wages a two-front war on the brain. It builds beta-amyloid plaques, sticky protein fragments that gum up the space between nerve cells. At the same time, it creates tau tangles, twisted fibers of another protein that build up inside the cells, choking them from within. For decades, treatment was a dead end. But in 2023, the FDA granted full approval to a new drug, lecanemab. It's not a cure, but it's the first of its kind to show a meaningful impact, slowing cognitive decline by 27% in early-stage patients. It works by targeting and clearing those amyloid plaques. Genetics play a terrifying role. A specific gene, APOE4, acts as a powerful risk factor. Having one copy triples your risk. Having two copies, one from each parent, can increase your risk by up to 12-fold. For millions, the fight against Alzheimer's isn't just a possibility. It's written into their code. Parkinson's tremor. In 1817, London surgeon James Parkinson publishes a short essay. He details the cases of 6 individuals suffering from what he calls the shaking palsy. He notes the characteristic resting tremor, the stooped posture, and the shuffling gait. The root cause lies deep within the brain, in a region called the substantia nigra. This area produces dopamine, a critical neurotransmitter for controlling movement. Parkinson's disease systematically destroys these dopamine-producing neurons. The tragic irony is that the symptoms, the tremor, the rigidity, the slowness, only begin to appear after 60 to 80% of these cells are already gone. By the time it's diagnosed, much of the damage is irreversible. Today, it affects nearly 1 million people in the United States alone. The cornerstone of treatment arrived in the 1960s with levodopa, or L-DOPA. It's a chemical precursor that the brain can convert into the dopamine it so desperately needs. It manages symptoms, often dramatically, but it doesn't stop the underlying cell death. For patients whose symptoms are no longer controlled by medication, there's a more radical option. Deep brain stimulation, or DBS, was approved by the FDA in 1997. It involves surgically implanting electrodes into the brain to deliver electrical impulses, overriding the faulty signals that cause the tremors. We can send in a signal, but we still can't save the cells. Stroke clock. A stroke is a brain attack. It happens in one of 2 ways. The vast majority of cases, 87%, are ischemic strokes, where a blood clot blocks an artery, starving a part of the brain of oxygen. The other 13% are hemorrhagic, where a blood vessel ruptures, causing bleeding into the brain tissue. The statistics are relentless. In the United States, someone has a stroke every 40 seconds. Someone dies from one every 3.5 minutes. It is a leading cause of long-term disability and is responsible for 1 out of every 21 deaths. For ischemic strokes, the clock is the enemy. There's a powerful clot-busting drug called TPA, but to be effective, it must be administered within a critical 4.5-hour window from the onset of symptoms. Every minute that passes, millions of brain cells die. To drill this urgency into the public consciousness, the FAST acronym was created in the UK in 1998. Face drooping, arm weakness, speech difficulty, time to call emergency services. It's a simple test for a complex and devastating event. When the blood stops, a part of the brain starts to die, and it does not grow back. Epileptic storm. The human brain operates on a delicate balance of electrical signals. Epilepsy is what happens when that balance shatters. It's characterized by sudden, uncontrolled bursts of electrical activity, a sort of electrical storm in the brain, that result in seizures. This isn't a rare disorder. Epilepsy affects 3.4 million Americans, or about 1.2% of the population. Humanity has known about it for millennia, often attributing it to supernatural causes. The first truly effective medical treatment didn't arrive until 1857 with the use of a simple salt, potassium bromide, which calmed the brain's excitability. In the 1920s, another, more unusual treatment emerged: the ketogenic diet. Researchers found that a high-fat, ultra-low carbohydrate diet could significantly reduce seizures, especially in children, by changing the brain's metabolic fuel source. Despite modern pharmacology, epilepsy remains a stubborn foe. For about 30% of patients, their seizures are resistant to all available medications. They live with the constant knowledge that at any moment, without warning, their own brain can turn against them. Multiple sclerosis. Your nerves are like electrical wires. Most are coated in an insulating layer called the myelin sheath, which allows electrical signals to travel quickly and efficiently. Multiple sclerosis, or MS, is an autoimmune disease where the body's own immune system mistakenly attacks and destroys this myelin. When myelin is damaged, the nerve signals are slowed, distorted, or stopped altogether. The resulting symptoms can be wildly unpredictable, affecting everything from vision and balance to muscle control and memory. It's often called the snowflake disease because no two cases are exactly alike, depending entirely on which nerves are being attacked. MS is a disease of the young, most often diagnosed between the ages of 20 and 50. It also shows a strong gender bias, with women being nearly 3 times more likely than men to be diagnosed. For a long time, there were no treatments to alter the course of the disease. That changed in 1993, when the FDA approved the first disease-modifying therapy, a form of interferon beta-1. Today, there are over 20 such drugs, all designed to suppress the immune system's misguided attack. They can slow the damage, but they can't repair what's already been lost. Glioblastoma. Not all brain diseases come from the inside. Some invade from the outside. A brain tumor is an abnormal growth of cells, and the most common and deadly primary tumor in adults is glioblastoma. It is relentlessly aggressive. The average survival time after diagnosis is just 12 to 18 months. The 5-year survival rate is a grim 6.9%. These tumors grow tentacled-like projections deep into the brain tissue, making them impossible to remove completely with surgery. The field of modern neurosurgery was pioneered in the early 1900s by Dr. Harvey Cushing, who developed techniques that dramatically improved the safety and success of tumor removal. But even he was humbled by glioblastoma. The modern standard of care, known as the STUP protocol, was established in 2005. It combines surgical removal of as much of the tumor as possible, followed by 6 weeks of daily radiation and chemotherapy. It's a brutal regimen, and yet it only extends median survival by a few months. It remains one of the most challenging and heartbreaking diagnoses in all of medicine. Huntington's gene. Some brain diseases are not about risk factors or environmental triggers. They are about certainty. Huntington's disease is caused by a single, defective gene on chromosome 4. It's a genetic stutter, a repeating sequence of DNA that is too long. The gene itself, the HTT gene, was finally located in 1993 after an exhaustive 10-year search by a global consortium of scientists. The inheritance pattern is autosomal dominant, which means if one of your parents has the defective gene, you have a 50% chance of inheriting it. And if you inherit it, you will develop the disease. There are no exceptions. The disease causes a progressive breakdown of nerve cells in the brain. Symptoms usually begin between the ages of 30 and 50. It's known for causing chorea, a series of involuntary, jerky, dance-like movements. But it also causes devastating cognitive and psychiatric decline. It is a slow, predictable, and currently unstoppable march towards total dependency. ALS Paralysis. On July 4, 1939, baseball legend Lou Gehrig stood before a packed Yankee Stadium and declared himself the luckiest man on the face of the earth. He was dying from a disease that would soon bear his name. Amyotrophic lateral sclerosis, or ALS, is a neurodegenerative disease that specifically attacks and destroys the motor neurons, the nerve cells that control voluntary muscle movement. As these neurons die, the brain loses its ability to initiate and control everything from walking to speaking to swallowing and, eventually, breathing. The mind remains sharp, trapped inside a progressively failing body. The disease is swift and merciless. The average survival time is just 2 to 5 years from diagnosis. For decades, there was almost no progress. The first drug, riluzole, was approved in 1995, but only extends survival by about 3 months. Public awareness exploded in 2014 with the Ice Bucket Challenge, a viral social media campaign that raised an astonishing $115 million for ALS research worldwide. It brought a forgotten disease into the spotlight, funding new research that provides a glimmer of hope against a prognosis that has barely changed since Lou Gehrig's final game. Traumatic brain injury, or TBI. In 1848, a railroad foreman named Phineas Gage was in a horrific accident. An explosion drove a 3-foot-long iron rod completely through his head, destroying much of his left frontal lobe. Miraculously, he survived, but he was changed. His personality, his ability to plan, his social filter, all were altered. His case provided the first real evidence for the role of the frontal lobe in personality. Traumatic brain injury, or TBI, is a leading cause of death and disability. In 2021 alone, the U.S. saw over 69,000 TBI-related deaths. It contributes to nearly 30% of all injury deaths. To standardize the assessment of these injuries, the Glasgow Coma Scale was developed in 1974. It's a 15-point scale that measures a patient's eye, verbal, and motor responses to classify the severity of the injury. For athletes in contact sports, there is a particularly terrifying risk. Second impact syndrome can occur when a person suffers a second concussion before the symptoms of the first have resolved. The brain, already vulnerable, can swell catastrophically, an often fatal event that can happen in a matter of minutes. CTE Enigma. The brain can suffer from delayed injuries, wounds that fester for decades. Chronic traumatic encephalopathy, or CTE, is a progressive degenerative disease found in people with a history of repeated head trauma. It was once called punch-drunk syndrome in boxers. The modern understanding of CTE began in 2002. A forensic pathologist named Dr. Bennett Omolu conducted an autopsy on Mike Webster, a beloved Hall of Fame center for the Pittsburgh Steelers, who had died at age 50 after years of bizarre behavior and cognitive decline. Under the microscope, Omolu found clumps of tau protein, but in a pattern distinct from Alzheimer's. He had identified the first case of CTE in an NFL player. The disease is an enigma. It can only be definitively diagnosed after death by examining brain tissue directly. Research on living patients is still developing. A 2023 study from Boston University found that 91.7% of former contact sport athletes who donated their brains showed signs of CTE. The link between repeated hits and future decay is becoming undeniable. Meningitis infection. The brain and spinal cord are wrapped in 3 protective membranes called the meninges. Meningitis is the inflammation of these membranes, usually caused by an infection. The cause can be fungal, viral, or bacterial. Viral meningitis is usually far less severe. Bacterial meningitis, however, is a profound medical emergency. It can progress with terrifying speed, leading to permanent disability or death within hours if not treated immediately with powerful antibiotics. The classic symptom is a severe, sudden headache accompanied by fever and a stiff neck, where the patient is unable to touch their chin to their chest. Before the development of vaccines, it was a common and feared killer of children and young adults. The first effective vaccine, targeting Haemophilus influenza type B, was introduced in 1985 and has since saved millions of lives. It's a stark reminder that sometimes the greatest threat to the brain isn't a flaw in its wiring, but a microscopic invader from the outside world.
Prion disease. This is the strangest, most terrifying brain disease of all. It's not caused by a virus, a bacterium, or a fungus. It's not genetic in the typical sense. It's caused by a protein, a misfolded, infectious protein called a prion. Prions are a corrupted version of a normal protein found in the brain. When a prion comes into contact with its normal counterpart, it triggers a chain reaction, causing the normal protein to misfold as well. These misfolded proteins aggregate, forming clumps that destroy brain tissue, leaving behind sponge-like holes. The most common human form is Creutzfeldt-Jakob disease, CJD. In the UK, a variant emerged from the mad cow disease outbreak, which peaked in 1993, after people ate meat from infected cattle. Prions are nearly indestructible. They resist heat, radiation, and the sterilization methods that kill other pathogens. There is no treatment and no cure. Prion diseases are 100% fatal, often progressing from first symptom to death in under a year. It's the closest thing medicine has to a real-life zombie pathogen,